your hairs. And then the smooth part is the one which makes the posterior wall, and that is the one, the receiving channel, and which has so many openings of different structures which come to this right atrium of the heart. Right atrium of the heart, it primarily receives superior vena cava and inferior vena cava. That is from upper body and lower body. And from the heart itself, it collects blood through the coronary sinus. After that, we had anterior cardiac veins, which brings blood from the anterior part of the heart. Now, this is known. Beyond that, we had vena cauda minimus, Thebesian vessels. So like this, there are so many fine details. But that is not for you. And we purposely omit these fine details, because if anybody wants to get in these sort of discussions, then you should do some PhD program, get in that, or you want to pursue your career as a cardiologist, then I doubt you may need to know those things. Otherwise, stay with common, basic, normal structures, and where you can talk of their applications as well. So primarily, the right atrium of the heart receives superior and inferior vena cava, coronary vein, and anterior cardiac veins. Is that right? So we know now we had an anterior wall which is rough, pectinate arrangement, and then we had posterior wall. Furthermore, there is a landmark, crista terminalis, and this landmarks differentiate between the rough part and the smooth part. Externally, which this crista terminalis is externally presented by sulcus terminalis. So on the basis of its presence, you can say in front of it is the anterior part and behind this is the posterior part. Is that clear so far? Yeah. Going further. Yes, Saeed.
Does it mean that from inside there is a solid, from outside there is a groove?
Outside there is a dip in, and inside the area is raised. Right? The same structure. From outside we call it sulcus. Inside we call it crista. You like to call it sulcus or sulcus, it doesn't matter. One is British, one is American word. The way you want to say. Now, going into the medial wall of the right atrium of the heart, it contains an oval structure. We call it fossa ovalis. This fossa ovalis, we get it from, there was an opening when we were not born. At that time, this opening was known as foramen ovale. And this opening, if you recall, if you go through your fetal circulation, the direction of the blood, we were all getting blood from our mothers, and that was being circulated. And this foramen ovale was one of the integral part. And then it is supported by two valves. One is septum primum, another one is septum secundum. And these two valves are arranged in such a way, when any baby borns, the first thing, when we all born, we were pushed to cry or we cry ourselves. How we were pushed to cry? We were slapped first. The first thing when we came to this world, we were slapped on our butts. We all got. Those who didn't cry, they get more slaps. So first we were asked to cry. We were pushed to cry. To open what? No. We were asked to cry. We were pushed to cry. And remember, this cry is one of the very important landmark, and it is being recorded. And with every childbirth history, it is mentioned how much time is taken by this baby to cry. And this is called as Apgar score. And if Apgar, APGAR, and this cry time is important. If you cry late, your mental growth is retarded. And you see someone tall, big, 10-year-old maybe, but the mental status is 4-year, 3-year, 5-year, something like that. So this little delay, little deoxygenation, little less oxygenation to the brain, it affects in a big way. So that's why it's very important at the time of birth, a pediatrician to be present just next to delivery room or operating room. And this cry of the baby has to be checked and recorded. Because what happens? With the first cry, the lungs of the baby starts functioning. And once lungs start functioning, it gets aerated. And once it gets aerated, once the baby is crying, the septum primum and septum secundum, they superimpose each other. Now blood stops going from right atrium to left atrium. And now it is following the right ventricle and then pulmonary circulation, because before lungs were not functioning. If you want to differentiate, this baby was born alive or born dead, take his lung, pour in water. If it floats, it means this baby, after his birth, he was alive. And then he was dead. Right? But he was born alive. Because the lung tissue, if it was never aerated, it will never float on water. But if it is aerated, it has to float, and if it's not aerated, it has to sink down in the water. That's the simplest test, which enables you to understand what happens. So this foramen veil has to close. And in those individuals where it don't close, what happens? It stays as a developmental defect, and we call it ASD, atrioseptal defect. And this baby have deoxygenated blood going to his systemic circulation. ASD is less common. VSD is more common. What is VSD? Ventricular septal defect. And what happens with these people, with these babies? Those who have ASD or VSD, cyanosis is not present all the time. When this baby is more active, more jumping, dancing, playing and all that, you can see this baby turns blue, start turning blue, exhausted, fatigued. Tip of the nose or these nail beds, they turn grayish blue or blue itself. The nose, when nose become blue, this is, and the lips gets blue, that is central cyanosis. And when these nail beds gets blue, this is the peripheral cyanosis. So when you have to check this cyanosis, if you are finding it, the blue tip of nose, obviously it's not jet blue, you have to make differentiation. So this is how one can differentiate, one can go about. And these defects has to be repaired surgically. It will never happen that automatically something regrows and they will close off. Right?
Yes.
I should like to comment on one thing. Any birth defect should be treated, should be looked for seriously. Some parents believe that, oh, it's fine, and some illiterate people advocate them, it will go fine with the time. I know one patient came to me whose son has his testis which has not reached to the scrotum. Now, it was a weak person who didn't check with a proper hospital setup, and he came when his son was around 8-year-old. And I asked, why you are prevented to go and see a hospital and a doctor? He said, someone told me, take your son on a mountain and climb down. With this effect of gravity, his testis will come down and to settle in this. Trust me, this is reality. I'm not exaggerating. It's not heard. I'm a witness to this. To that baby, here. I don't want to talk about what nationality was he. So anyway, ignorance, the soup. For ignorance, there are no boundaries. They are globalized. Here or there, it's no big deal. You may find it everywhere. Is that clear? So this foramen veil, if it persists, there's a disaster. Nasir.
So the foramen veil closed by the two bars?
Guys, what he's asking is important. Kashyap, something wrong? Kafaji is bugging you? Kafaji, you have something wrong with the testis? Ah, Nasir.
The foramen veil, does it close after birth by the
Just with the first cry.
yeah, by the two valves?
Uh,
Septum.
I don't have, I can draw it for you. What happens? These septi, they are just closed. And the opening is going like this. So once there is pressure changed, the pressure changed, these two septa, they come close. One opening was on top, one opening was below. And the blood was going like this. So once they oppose each other, they adhere, pressure change, it brought it back. Now this is one solid closed thing, blood starts flowing through its normal pattern, so then it's no more functional, it's no more foramina. Now we call it fossa. Huh?
The stenosis is caused by ASD or
VSD.
What is your question? What stenosis you're talking? That is the cyanosis is caused by having deoxygenated blood in your circulation. That's it. VSD or ASD? Primarily, tell me. Now listen to me. We have deoxygenated blood in the right atrium of the heart. If this deoxygenated blood start going into the left atrium of the heart, you will have what type of blood? Mixed type of blood. Or the blood goes to the left atrium, right ventricle. Then it is pushed to the lungs, being oxygenated, bring that oxygen into the left atrium, and then left atrium to the left ventricle, then you have oxygenated blood.
Yes.
But if there is in between leakage, you have mixed type of blood. So that will be the one which causes problem, and these kids needs to undergo surgery, and surgery has very good results. Big number of people, they born with the highest number goes for VSD, ASD is lesser than that, but the outcome is after surgery there is good cure and there is no big issue, and one shouldn't be dying for that. Is that clear now so far? Yes. So right atrium has so many other things, but I have touched upon those things which are very important, and I'm coming up with further more points. So let's now start with my slide. So the right atrium, we can see here, who's this guy? Crista terminalis. This is inside demarcation between rough and smooth parts. Now from where this rough part is coming, from where this smooth part is coming, let's wait for our embryology lecture. Let them, probably Paul or Zafar, they will talk about it. Now there you are looking at foramen vein, and now we call it here fossa ovalis. Going further, this is the opening of superior vena cava.
Which particular part we call it fossa ovalis?
This particular part
So inferior to the crista terminalis.
is inferior. Tell me, is it inferior?
Anterior.
I recommend you go to an ophthalmologist, get your eyesight checked. If you say it inferior, guys, is this inferior to this crista? Correct? I saw poor Ayman with his camera trying to put the light through this foramen fossa ovalis, trying to show you your whole lab, and what you are doing there? Superior vena cava. There you see the opening of inferior vena cava, coronary sinus, right? And coronary sinus, what it brings? We have great, middle and small cardiac veins. They runs around the heart like right and left coronary arteries. So all these veins, they ultimately open into coronary sinus, and that runs in the interatrioventricular sulcus. more prominent posteriorly, and it opens in the right atrium of the heart. Now, there you are looking at the tricuspid valves. And this is my septum. Interventricular septum, interatrial septum is almost closed. Once we say we have fossa ovalis. So now this is the tricuspid valve. You can see 1, 2 and 3. Guys, these structures are three-dimensional. But I am showing you over here only 1D image. It's not a 3D image. So don't expect you can see them in reality. But how they are arranged, I'll tell you what. So the right ventricle, what it contains? It contains these fibrous structures. These fibrous structures are chorda tendini. What is chorda tendini doing for us? Prevents what, Khalifa? Say it loud and again.
After the blood comes in and it has tendency to go back.
Who has tendency to go back?
The blood.
Why?
Because
Guys, how many Khalifas are sitting here, by the way? All Khalifas? When Khilafah?
because of the pressure difference.
Why?
Because the
Anybody can help him? Ilafadi.
During isopolymetric contraction, when the two valves are closed, there is a tendency for the AV valve to invert. So the chorda tendini and the papillary muscles hold it back from inverting.
Very simple. What he's saying, when blood comes here, this chamber is full. No problem. Everything is smooth. Now when this is contracting, blood can go down, go back.
Yeah.
When this is contracting, these flaps are the one who has to prevent the backflow of the blood. To do so, they have to, with the push of the blood, they go back. Before they were hanging. Now with the push of blood, they go up. But they are prevented. They can go up to a level where it's closed. They cannot do like this. So it's allowing only one-way flow. So they are anchors. They are supports of these valves. And they are acting as if you have seen a parachute or you have seen a tent. Sleep under a tent without its supports. See what happens tomorrow. Morning time, you are sleeping there and tent is gone in Yemen with the air. He'll bring it, fine. He'll sell it to you back. Is that clear? Now these are chorda tendini. And these are, Nasu, what's wrong? What is doing? Some physio? Are you okay? So these are chorda tendini, and these were the ropes who were supporting these flaps. And these pillars, these nails, which were present within the wall of this ventricle, these are known as, these finger-like projections, these trabecules, they are known as papillary muscles. Now don't ask me why they are called papillary muscles, I don't know either. And I don't want to know either. So these are, fine, Rasu will answer you. So stay quiet. So papillary muscles, and we have so many pattern of papillary muscles. We'll also be talking about them. I hope this concept is clear.
Yes.
Anybody who's in doubt? Thank you. So now we have papillary muscles, we have chorda tendini, and we had tricuspid valve. Right? Going further, there is one muscle band which goes transversely and it is attached to the interventricular septum and towards this wall of this right ventricle. So it's from a septum to a margin. We may call it septo-marginal trabecule or moderator band. And what is its beauty? It contains some conducting fibers, and that is its importance. We can use it for animal and human differentiation, That's not the objective for our today's lecture. Our objective is